Management knowledge is imperative for people who work in organizations, and hospitals are organizations. So logically, a person who can manage an organization manages hospitals. But many times I am asked a question: why do we need to learn hospital management as a separate discipline in itself? Management knowledge is imperative for people who work in organizations, and hospitals are organizations. So, logically, a person who can manage an organization can manage a hospitals. So, many times I am asked this question: why do we need to learn hospital management as a separate topic in itself? Why can't a person who can manage an organization in any other discipline apply his or her management knowledge to the context of hospitals? And the answer lies in the uniqueness of the context of hospitals. Let me explain it further. For example, people compare hospitality industry with hospitals, but if you carefully examine, these two industries are diametrically opposite. While in the former, the client comes for pleasure, in the latter, it is for the pain. And management of negative services like hospitals, where the patient comes in distress, is totally different from management of positive services like hospitality. Second, normally people describe organizations as pyramid with a narrow top and a broad base, and the top, which is narrow, is very significant. But in hospitals, it is different. A person at the lowest level of hierarchy, for example, an OT technician or a junior nurse or a ward boy, is as significant, if not more, than the senior doctor or the nurse in determining the clinical outcome of the patient. Hence, the concept of teamwork takes a totally new meaning in the context of hospitals. So, the concept of teamwork takes a totally new meaning in the context of hospitals, where the organization structure can be described as cylindrical rather than pyramidal. Third, there is an increasing incidence and prevalence of chronic diseases like autoimmune disorders, diabetes, metabolic syndrome, cancers, etc. And all of these diseases are multisystemic. That is, the patient require inputs from different disciplines within the hospitals, and each of these disciplines are unique. Hence, a good clinical care requires seamless coordination across these unique disciplines within the hospitals. That means the work and the information should flow in multiple directions simultaneously. This gives a very different meaning to the concept of coordination in hospitals. Fourth, the hospitals are typically knowledge based service firms. The manager needs to manage highly skilled, trained, and knowledgeable professionals, that is, the doctors. And the manager should be well aware of the nuances associated with this context. For example, knowledge management for doctors, or say, how to manage knowledge flow between the individual and the team. It is for these reasons and many others that I say that hospital management should be learned as a separate discipline in itself. And in recent times, we have seen that hospitals are growing large. In fact, they are becoming chains of hospitals, and many of them are listed on stock exchange. In this changing scenario, the relevance of hospital management as a discipline has increased manifold. Stakeholders say that hospitals should become more patient centric. In this program on hospital management from June 18th to 23rd, we will discuss and learn how can management principles be applied in the context of hospitals to enable the hospitals to deliver more patient centric care. For more details, log on to our website